So in monsoons, most of the infectious diseases which start happening or spreading are waterborne, and if we start listing them out as the more dangerous and the more common ones, they would be typhoid, they would be cholera, they would be hepatitis, they would be malaria and dengue. So in a monsoon situation, there is waterlogging and there is contamination of drinking water, or there is the stagnation of water which leads to vector-borne diseases. That's how taking care of good water hygiene and preventing waterlogging are two things by which you can actually prevent a lot of these illnesses. So jaundice and hepatitis are like a manifestation and an underlying disease. So hepatitis means inflammation or infection of the liver, and once a liver is affected, it starts to manifest in the form of jaundice. And jaundice, what you see is the yellowing of the skin or the eyes and the increased yellowness of the urine. So obviously they are interconnected, because only when you have hepatitis you start manifesting the jaundice, and when the hepatitis becomes severe enough, it starts having the increased bilirubin which comes across as jaundice, what we clinically see. So when you have hepatitis, there will be nausea, there will be vomiting, there will be lack of appetite, there will be fatigue, letharginess, drowsiness, and when it continues or becomes more severe, then there is yellowish discoloration of the urine, of the eyes, and that's what we call as jaundice. So hepatitis, especially during the monsoons, happens either with hepatitis A or E, or a combination of both, that is A plus E superinfection. What normally happens is that these illnesses are self-limiting. So once they start, they will pass through a phase and by themselves self-limit and finish off. What parents can be wary of doing is trying to modify the diet too much, or trying to do too much of homeopathic or other alternate sources of liver healing, because they usually have a potential to be more hepatotoxic, that is, they damage the liver considerably more, especially during these periods of crises. So there can be a complication which is not only limited to a delay in treatment. The complication can also arise in a very severe manifestation of the hepatitis. So these complications can be in the form of bleeding, in the form of altered sensorium, that is behavioral disturbances or sleep disturbances. They can also be water collection in the abdomen, that is called as ascites, and all these features are of a severe liver disease. So waterborne diseases would spread from a vector or directly by consumption of that bad water. Now hepatitis A and E pass through a phase, as I told you earlier. So once they are being shed in the stool, they have a chance of being exposed to the other family members, and that's where it can be contagious. So it can spread theoretically, but if you maintain a good water hygiene, you maintain a good hand hygiene, and you maintain a good sanitation barrier, then this spread can be nearly nullified. To prevent the contagious spread of this infection is what the caretaker needs to maintain. So for hand hygiene, it implies that washing the hands rigorously very well after each contact, especially while touching body fluids or stool samples. The other thing is sanitation barriers, that is the stool or the effluent, that is the body wastes, like the stool or the feces, the bathroom waste, should not come in contact with the drinking water. That is, the sewage and the drinking water should not mix at all. And the third is, you should always prevent waterlogging in and around your house.